Hi, here's part two where I'm going to show you some herbs and when and why I might use them and some stuff in my bag. So I like my bags to look pretty hippy-dippy. This is my prenatal bag, and I would probably bring it in just so that I have my watch. That way I can not bother mom, but know what time it is, how long it's been, when the baby's born, time contractions without bothering her. Really probably one of the most useful and underrated things. I don't like using my phone. It's distracting. And I would prefer to not have it while I'm doing all the things, but the phone does have a flashlight, a camera, a watch all in one. So sometimes you might grab that instead, but I prefer to have my watch just for reading time. That way I could use my phone as a flashlight if I needed to, or time two different things at the same time. You never know. I don't know why you do that, but it's nice to have the watch. And then on this side, I have like a tray already set up with the things that could be needed in the immediate postpartum. This is like the semi-emergency tray, so I like it to just be like a cute wood, and I just keep the baby blanket over it so that it doesn't seem like stressful or alarming or like something's wrong. But that way I have it over here on a table or in the corner somewhere in case one of these things are asked for or needed. And then underneath the blanket, I have a tray with the hemostats and cord scissors and a flashlight, a bulb syringe, a fresh one, some gloves, and flashlight, a bag and mask, and a baby stethoscope. I have a catheter on here from recently and a cord clamp. Although, like, of course, with more time and planning and preparation with the family, I prefer to talk to them about like sucking over the baby's nose and mouth, finding their own cord tie or special ribbon or something cute that they want to use on there instead of the clunky plastic clamps. Yeah, guiding them to maybe prepare some of this stuff and think about it more in a sacred and spiritual and ceremonial way. And then, this is like backup if there needs to be things that happen or there's help needed with some stuff, then I could have it. But typically laying around, they would have their own cord tie, the hairs, mom's mouth and breath right by her warmth, her closeness, all of that. And then my herb bag is on here, and it's in this cute little herby looking bag that says time to party. And it's not really a party. I hope to like not need these that much, but they're there in case I need them. And it's the time to party bag. So one that wouldn't be crazy to use, that's typical and maybe helpful in many applications, would be motherwort. And this can be used in the case of blood loss, like before it gets too crazy, or if it already has calming, soothing, restorative, grounding mother presence. Yes, thank you, motherwort. Angelica. She might do motherwort and angelica together. Angelica's for helping bring the placenta. So I have a sheet about postpartum hemorrhage, bleeding after birth. I just called it that because I don't like saying hemorrhage a million times over and it just sounds scary and not that fun. So I have bleeding after birth, I have before placenta, after placenta, and that's very two clear things. And the main difference is that Angelica is for before the placenta and you wouldn't need Angelica after. So I would probably combine Angelica and motherwort for helping with the placenta. And then maybe if it seemed like the uterus needed some support in addition to that, and having like the warm tea nearby in a cup, you can add these to it or put these directly in under her tongue. And the sugar involved with this could help just overall giving her energy and all of that too. But if it seemed like we needed more contraction with the uterus to help bring the placenta, you might add in some cotton root bark or some black and blue cohosh. So. And then if it's after the placenta, forget the Angelica. Don't need that one. You want to have yarrow. This one, like the label's kind of worn out, but it's yarrow. Cotton root. I would still use motherwort probably, and your black and blue. There you have it. And I don't even think maybe all of these necessarily, probably just cotton root, yarrow, and motherwort. Give a nice big dose and then repeat it if needed. And just, hopefully that helps, and or talking to the mom, giving some guidance to clamp that uterus down, and probably calling for help anyway. So the guidelines are on the back for this with transport. So say I gave all of those, try to see if there's some clots and get the clots out by pushing on the uterus. But, leave the uterus alone before all this. Like, just give the herbs, see how those work, see if there's clots during a contraction by maybe asking her, guiding her to push on that to get the clots out, have baby at the breast. You could do the placenta thing, put a piece of placenta or cord in the cheek and bite down with your teeth. Give her some drinks, water, electrolytes, the warm tea with all the yummy, sugary, warming stuff that helps the uterus contract. And you can even tell her your uterus is going to firm and contract. You're present, keep all of your blood. And peeing could be part of this, so seeing if she can pee. Everything should feel much better if the uterus is empty and the bleeding has stopped, but you still may want to transport. Even if the bleeding stopped, she could just have lost enough where she's going to feel yucky and she may need more blood. Or, you don't know if you have all the information to know why that happened and if you resolved it all. So it might be good to just suggest going in for more support. But yeah, that's what I have on my end for the herbal side. There's a couple others. So obviously there's drugs. And some people go straight to drugs and some people do herbs and then drugs, or just herbs and transfer. It really depends on who you have supporting you and what you want. Pitocin, obviously, midwives just draw it up just in case at every single birth and have it around. And maybe would just go straight to Pitocin or give herbs and then give Pitocin. And that would be probably an intramuscular injection right in your thigh to get synthetic oxytocin to clamp your uterus down. What else? I don't know. That's a lot. But here's like the general stuff that I have and the guidelines that I would follow and the ways that I would support women in first seeing how much they're losing and helping to assess that and letting them know. And then also providing some herbal support earlier on, hopefully in the process before things get crazy. But if they do, then knowing what to do, trying all the things and calling for additional support. The other great one I was going to say, so a lovely 74-year-old midwife who attended water births for 50 years, she swore by this supplement, I don't know what you would call it, ionic sea mineral called Kenton. And she preferred it to Pitocin for bringing that homeostasis back in the body with minerals and water. And they come in these glass vials and you break them open and woman just drinks a very pure form of a special kind of seawater or sea minerals, and that can help stop the bleeding as well and just, get that balance right in the body. So that's something that I plan on having and will consider using, as well as the herbs and the hands-on support that I could give either with just guidance in helping birth the placenta or, pressure to stop the bleeding, bring the uterus down together, and really listening to her symptoms and feelings to assess whether this is normal for her or she needs support is all within the realm of things that I am learning, and I'm so happy to get to share some of that with you guys. And I know there's wonderful people out there who are so well versed in this and can offer so much more wisdom and tips on it. So I will share some of the resources that I used to put this together, things that I had mentioned that I have in my bag, and all the different ways it can look to support, mostly coming from this place of centering the mother and her experience and what she's wanting, supporting free birth, autonomy, unassisted birth, while also bringing some knowledge, skills, and experience to the situation when it's desired or needed, and then leaving well enough alone when it's not. So it's such a balance that I'm learning from and walking every day to kind of bridge the gap between full autonomy and, midwifery knowledge and, higher levels of care and, healthcare providers, bringing all those things together so that hopefully the mom can be supported in everything that she wants and needs, whether it comes from me or a higher level of care, or she doesn't need any of it at all. So thank you so much for listening. And yeah, I also want to instill that like sometimes and most of the time, nothing is needed. And that there's so much in women that we can trust about birth that it generally works. And this stuff is like totally normal, just like pooping. And there is a sacredness to being honored and witnessed and noticed in this huge transformation. So, yeah, that is just a mix of things that I am bringing together all the time. And I hope that you enjoy hearing about it and maybe you have your own explorations into how this can look. And yeah, reach out if you have questions. I feel like there's even a deeper dive that I could go on if you're planning an unassisted birth about things to look for, things to have around. But it is so great to just continue learning and finding support where you can get it.